Hello everyone, myself Dr. Aditya Gupta. So, NEET PG is just one and a half months away, 40 days away from your NEET PG entrance examination. And in this video, I want to talk about something which I'm sure I have talked about in my multiple videos. But मैं एक और बार तुम्हें emphasize करना चाहता हूँ. You'll be listening to a lot of 1 month strategies. You'll be listening to lots of 40-day strategy. But the only strategy that matters, the only thing that actually matters is last 1 week revision. Now, why is this last 1 week revision so important actually? Simply because of the fact that there are 19 subjects and you cannot remember them all in no matter how great your memory is. I am someone who prides myself on having a great memory, but you tend to forget. Remember one of my videos that I forgot which clotting factors are involved as far as vitamin K is present. We all are humans, our memory is limited and our memory is fragile most importantly, and our memory is volatile and we tend to forget things. So if we have not revised in the last 1 week, if you have not revised in the, if not 1 week, if you have not revised in the last 10 days, even the easy questions we won't be able to mark them correctly because two options are going to confuse us. Two options are going to be like, hey, whether this is the correct answer, whether this is the correct answer. To get the accuracy that the exam demands, you need to be able to revise the entire sub-syllabus or at least the very high yield topics in the last 10 days. This is my revision schedule, which I think if you, let's say you are starting from 25th of February till 5th of March, this is something which I feel everyone should follow, that you should try to finish most important topics, the most high yield topics, especially the past 5 to 10 years previous year questions of these subjects in this manner, in which towards the end, that is on 2nd, 3rd and 4th March, you should try to do those subjects which are very volatile. Anatomy, very high yield, 15 questions, 20 questions at times. If we consider questions, nerve injuries and stuff like that, they might be considered orthopedic questions, but they're actually anatomy questions. 15 questions. You will get them, all of them correct if you revise anatomy in the last 1 to 2 days. Similarly, biochemistry. Questions are never tough in biochemistry, to be honest. It's just that we have not revised biochemistry towards the end. Questions are never tough in pharma also, to be honest. It's just that we have not revised pharmacology towards the end. Subjects like physio, medicine, we tend to remember them more. We tend to like them more. Do them towards the end of that last 10 day, so let's say you're starting from 25th of February, you are starting your last 10 day revision from 25th of February. Ensure you do your less volatile subjects like medicine, surgery, big subjects towards the at that beginning, and towards the end you go towards your most volatile subjects. These subjects can be interchangeable depending upon your preference, depending upon the what is your strong point, what is your weak point. I was excellent in biochemistry, I keep on emphasizing. I did not do biochemistry towards the end. I probably did biochemistry somewhere here. I was very weak in anatomy. I did anatomy towards, a lot of people keep on DMing me asking me ki sir anatomy ke liye koi cheez batao. So my simple thing was I had a set of notes. I had a set of Dr. Ashwini's notes, I had revised them 1 month prior once in 2-3 days, and then I did anatomy in the last day. I did not remember anatomy 1 day before that. I did not remember anatomy 1 day after my exam. But since I had revised anatomy on the last day, on the exam day, I got all the questions in anatomy correct, because anatomy is that easy, but it is that volatile also. The same is valid for biochemistry. Same is valid for pharmacology. If you're good in these subjects, great. Maybe do them earlier. If you think your surgery is very volatile, I'll say do surgery. But surgery is a big subject. I'll ask you to do it towards the 7 to 8 day margin. And most importantly, I'll keep on emphasizing 1 PYQ per day keeps FOMO away. Don't be in any FOMO. Don't be in FOMO of my app also, although I'll give the link in the description. But you should solve your previous year questions, and that's why in this video also I'll be doing the FMGE recall. You have to realize that questions can literally be picked up from this FMGE in your exam. So I'll be doing the FMGE recall of pediatrics in this video. Just stay with me in this video, and we'll see that how each and every one of this question actually was a previous year question. So let's start with this FMGE recall. First question was, which is following is a contraindication for breastfeeding. This is a FMGE recall. This is an FMG. If I'm not wrong, it was asked in 19 or 20 in FMG itself. The answer here is galactosemia. So we know that galactosemia, uridyl 1 phosphate, I'm forgetting the name of the enzyme. See, that's what I'm saying, you know, I'm a pediatrician, even I tend to forget the exact name of the enzyme. Doesn't matter, if even I don't revise, I won't remember. The point is that since, you know, in glucose, lactose is made up of glucose plus galactose. A child who's suffering from galactosemia, they won't be able to metabolize lactose, and hence galactosemia is the only contraindication as far as breastfeeding is concerned. The other options were HIV infection, HSV infections, and so on and so forth. No, these are not contraindications of breastfeeding. Only galactosemia, this metabolic disorder, is considered a contraindication as far as breastfeeding is concerned. The other question was, a 5-year-old boy comes with pedal edema, albumin 2.0, and effacement of podocytes. It's simple. What is the child? So their pedal edema is occurring because albumin is 2.0. Right? And why is this albumin 2.0? Because there is effacement of podocytes. Where are podocytes? Podocytes and kidneys. So kidneys losing your protein. And when does kidney lose protein? It loses protein in nephrotic syndrome. And then they asked which cause of nephrotic syndrome as far as nephrotic syndrome is concerned. So this effacement of podocyte, podocyte is characteristic of minimal change disease. Again, it's a previous year question. If you have done your past 5 to 10 years previous year question, this is an exact repeat of a previous year question. So you have to do your previous year questions thoroughly. The next question that came was, a 7-year-old child comes with fever and neck rigidity. Along with that, there is hilar lymphadenopathy. So fever and neck rigidity suggests this is what? This is a case of meningitis. This is meningitis, and they are now trying to tell you whether it is bacterial meningitis, tubercular meningitis, fungal meningitis. How do they tell you? They will give you another clue. They give you the clue that there is hilar lymphadenopathy. So hilar lymphadenopathy, the hilar lymph nodes are enlarged as far as TB is concerned. So you have meningitis, you have your TB, the answer will become tubercular meningitis. So that's how they frame the question. Now again, this might seem like a new question to you. This is not a new question. Meningitis has been asked multiple times. TB has been asked multiple times. They combined two previous year questions together and they made a new question. Again, a previous year question repeat. Fever, cough, coryza, conjunctivitis, what's the diagnosis? I don't know whether they gave you an image or not. This answer is simple. This conjunctivitis, makes it easy for you. Fever plus conjunctivitis in a 5-year-old child characteristically occurs in measles. This is also 2018 repeat if I'm not wrong, 2018 or 2019. Again, repeat. Earlier they probably would have given you an image of a child with conjunctivitis. This time they're simply giving you a description. Fever with conjunctivitis, this is measles. You will be like, fever with conjunctivitis can occur in multiple cases, yes. But a 5-year-old child with fever, cough, coryza, conjunctivitis is measles until unless proven otherwise. I'm not sure whether they gave you rash or not. If they give you rash, it's even more obvious that it is measles. People would have gotten confused whether it's chickenpox. Chickenpox won't have this conjunctivitis. It might have that rash. Other things. So this conjunctival and cough and coryza is typical what is of measles. Another question. A newborn, chest compression. When do you start? So NRP, neonatal resuscitation protocol. That NRP, that single one page that has been asked. It can be AIMS, it can be your NEET, it can be your INI-CET, it can be your JIPMER, it can be when JIPMER was conducted. That single one page will always give you one question. That is a given, and that's how you decide your high yield topics. Like let's say you have to revise towards the end. You should know that okay, NRP एक बार revise करके जाना है. Pediatrics probably mid range में मैं रखता अपनी revision में, वो 7-day revision में मैं mid range में रखता. But NRP I would have revised on the last day, because NRP say they will ask multiple questions. They ask this a question, so we begin chest compression as far as NRP is concerned when the heart rate is less than 60. This also is a previous year question repeat of FMG. Another question. A newborn, what is the FIO? You start the resuscitation, what is the FIO to use? This is not a previous year question repeat if I'm not wrong. This is not a repeat, fair point, this is not a repeat. But like I told you, if not a repeat, it at least is coming from that very, very high yield topic, that is neonatal resuscitation protocol. If they're asking you multiple question in NRP, you should be thorough with each and every aspect of NRP. So as far as FiO2 for resuscitation is concerned, you start with 21% if it's a term baby. I don't know whether the question asked a term or a preterm. If it is a preterm baby, according to NRP, you start at 21 to 30%. In AIMS, we start at 30% as far as a preterm is considered. But if the heart rate is less than 60, like in previous question, and you're doing chest compression, then you increase this FiO2 immediately to 100%. Again, not exactly a previous year question repeat, but definitely from that NRP topic, definitely it has been asked. Last question that I am going to discuss was simple, and marasmus was Kwashiorkor. If I'm not wrong, they gave you image of a child who had a pot belly. You know, that pot belly is characteristic, that fatty liver and edema is characteristic of Kwashiorkor. Marasmus child will be emaciated. He will not have any muscles whatsoever left. Kwashiorkor child will have edema, will have fatty liver, albumin will be low, he will be apathetic, he will be lethargic. And again, a previous year question repeat, you can check exam, a very famous topic, marasmus was a Kwashiorkor. So if I actually look at the previous year, if I look at the number of questions that in this FMG as far as pediatrics was concerned, I would say that 70%, 70 to 80% of the questions were direct, like just a small modification and direct repeats previous year question. The remaining 30% also were derived from previous year topics. Maybe they are user, NRP, like, NRP is a topic. I would not say that exact questions of neonatal resuscitation were repeated, but that neonatal resuscitation topic is so important. Similarly, Kwashiorkor, marasmus, maybe not the same question is being repeated, but you have to do Kwashiorkor and marasmus. And if you are not thorough with your previous year topics, I'm so sorry to tell you, you won't be able to crack this exam. So that's it from my side today. Thank you and have a nice day.